Well, today marks World Bipolar Day. The day is marked annually on March 30th in order to raise awareness and understanding of bipolar disorders and to eliminate social stigmas that are associated with them. Life Healthcare is emphasizing the urgent need to address mental health issues among South African employees, and the data reveals that a 5.2% increase in risk cases, which is negatively affecting productivity through absenteeism as well as presenteeism. For this discussion, then, we have roped in Dr Karisha Quarrie, who's the Chief Medical Officer at Life Healthcare. Dr Quarrie, welcome to the show today. Thank you so much for your time. So what do you attribute as this biggest contributing factor to these alarming rates in mental health risk cases? And what exactly are we referring to when we say risk cases?
Good afternoon, Alicia, and good afternoon to all your viewers. In any mental health condition, a risk case is somebody who is going to be harmful either to themselves through an episode of suicide, or they're going to be helpful to another. They're going to be harmful to another person through an act of homicide. It also means that the individual is at risk of taking a financial risk, so excessive gambling, or a risk in terms of their sexuality by having multiple partners or unprotected sex, or having some kind of behavior that is going to have reputational or social harm to that individual. And what we are seeing through our employee wellness program and the studies that we conduct in that space is that we are seeing that there is an increase in the percentage of callers that come through that call center presenting with signs and symptoms of being an at-risk case. Mm-hmm. Thanks, Alicia.
Doctor, how much then does this impact on overall workplace productivity? You heard there, and I'm sure you also referred to it about the fact that it's actually negatively affecting productivity through absenteeism and people just showing up to work, because some of these companies don't even have policies or any resources to cater for those people who could be at risk of these mental disorders.
That's absolutely true, Alicia. Globally, we've got 12 million working days that are lost due to presenteeism and absenteeism as a result of workplace stress. That is absenteeism and presenteeism. And absenteeism is people who are so stressed that they cannot come to work or do not present themselves for work. And presenteeism are people who come and pitch up in the workplace but are not productive in the area that they are meant to be productive in. And then we see also that the bottom line impact for employers is that 18 trillion rand per year is lost as a result of a lack of productivity due to mental health conditions. And so we see that this is a significant impact of how mental health disorders impact the business and working environment, and why it's important for employers to institute an employee wellness program in their space.
Absolutely, Doctor. Are there then, besides what you've just mentioned, any other additional practical steps that employers then can actually take to support their employees?
Absolutely, Alicia. One of the first things, besides the investment in an employee wealth program, is to train the managers and the other employees. Oftentimes, people who are affected by a mental health condition, either because of their own stigma or understanding of mental health, don't disclose that they have a mental health condition, or, especially in a case of somebody who has bipolar mood disorder in a manic phase, they may not even be aware that they are displaying symptoms of a mental health disorder. So it is important that managers and other employers are aware of the signs and symptoms of a mental health condition, and then to actively address that through an employee wellness program, and to really address the triggers for a mental health breakdown early on. So when a person is already displaying presenteeism, absenteeism, or other negative workplace behaviors, that they should be addressed really early on, rather than waiting for somebody to have a total mental health breakdown.
Absolutely, doctor, because I suppose also the issue, as you've just stated, the importance of early diagnosis as well as treatment then becomes paramount. But I want us to go back to that issue of stigmatism, because basically some employees or even the individual themselves is not aware that they're actually suffering through these conditions. So what happens in that instance where then a company cannot take any action to assist said employee?
Yes, so many times, and especially in our South African setting, we have differences in how a cultural belief system incorporates the beliefs of a mental health condition. And what we have to appreciate is that as South Africans, we have very different cultures in one working environment, but also that the workplace itself has its own culture. The organization has its own culture. Now, if the organization doesn't have a culture where it is non-discriminatory, where it is inclusive of people of different races, genders, sexuality, then it adds additional stress into the workplace environment, and it makes the cultural destigmatization of mental health disorders that more difficult to do. So a company really needs to understand what is their culture, and it makes sure that that culture is not discriminatory to any specific group of individuals, and to also have open dialogue with employees to understand what do they understand by mental health disorders, and even to promote support groups within the working environment. Obviously, these support groups must ensure that there's confidentiality of the discussions that are being held, because it is a health condition and therefore is protected by the rules of confidentiality. But there must be a culture within an organization that fosters the ability for employers and employees to discuss mental health conditions in a safe environment.
You know, that's a very, very important and crucial point there, doctor, because, we've seen quite a lot of misdiagnosis because, some companies just simply, or even individuals themselves, do not understand, even if a person is actually presenting some of these mental disorder symptoms. But maybe let's talk about some of the resources then available, maybe say through Life Mental Health, and how then workplace factors can also trigger or even worsen these bipolar symptoms. How does then the work environment as well as the workplace organizational culture assist that person to, to live a better life even after leaving the workplace?
Yes, the first step is that all levels of employer or employer and employee must be aware of mental health through an education program. Leadership within an organization must buy into the importance of mental health for their employees. And this must be whether it's a small company or a big, large listed company. The company must invest in employee wealth programs that actually practically are able to assist employees with their wellness. And must understand, what does wellness, especially mental health wellness, mean to the staff or to the employees? And that's through employee forums, through employee feedback surveys, understanding really what the needs are. Oftentimes you will get employees or employers who will institute a practical thing like, say, mani-pedi day at the office.
Yes.
But that's not really practically what the staff really want. And so it's important that there's a dialogue between leadership and management and the employees, and understanding really what are the stresses in those employees' lives and how to alleviate and mitigate that. And then what is really important, especially for mental health conditions, as I've mentioned, is to create a culture within the organization where nobody feels victimized or vilified for speaking about mental health, and where confidentiality is protected utmost between those who disclose that they have a mental health condition, and that they are supported through their journey of a mental health condition rather than being punished or they're being punitive. And that will speak to workplace policies that are guided by legislation as well as by employee wellness principles.
Absolutely,
So
Dr.
those are just some of the guiding steps that a company can use.
Absolutely, Doctor. I mean, we're hearing high suicide, GBV cases, even violence cases that are actually on the rise being reported as part of these, even in workplaces. So it's quite something that needs to be revisited, and some reforms really need to be, of course, impacted there. Thank you so much for your input. That is Dr. Karisha Quarrie. She's the Chief Medical Officer at Life Healthcare as we observe World Bipolar Day.